Part A. Extract 1. Questions 1 to 12. You hear a GP talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Good morning, Mihira. How can I assist you?
Hi, Dr. Green. I've been feeling quite uncomfortable lately. For the past few weeks, I've been experiencing these strange, painful bumps on my skin. They're mostly on my legs, but a few have appeared around my underarms too. It started as just one or two, but now there are more, and some have become red, swollen, and extremely tender. A couple of them even started oozing a bit of pus, which really scared me. I haven't had anything like this before, and I'm not sure what's causing it.
That sounds distressing. Can you tell me more about this, Mihira?
It all started maybe a month ago with just a few tiny red spots that I thought were just irritation from shaving. At first, they were small, so I didn't think much of them. But over time, they've grown in size. The skin around them feels tight, especially when I walk or move my arms. There's also this itching and burning sensation, which can be really annoying. I've tried over-the-counter creams, but nothing seems to be helping. I also noticed that some of them are quite deep under the skin, and they hurt when I touch them. The worst part is the pain. Some throb constantly, and at night it gets even worse, making it hard to sleep.
I see. Have you noticed any other symptoms?
No fever or anything like that, but I do feel tired more often lately. I'm not sure if it's related to this or just from not sleeping well because of the pain. I haven't noticed any swelling in other areas of my body either, and my appetite has been normal.
Thank you for that, Mihira. Now, could you tell me about your medical history?
Well, I haven't had anything like this before. As for medications, I'm not on anything regularly, except for an occasional painkiller like ibuprofen when the pain becomes unbearable. I've also tried some antihistamine tablets, thinking it might be an allergic reaction, but they didn't help. I usually stay quite healthy, so this has been really unusual for me.
That's helpful to know. Do you have any family history of skin conditions or other health problems that might be relevant here?
Not really. My mother has eczema, but that's been well managed with steroid creams. No one else in my family has had issues with their skin, though. My father has diabetes, but I don't think that's connected to what I'm dealing with.
It doesn't seem directly related, but it's still good to be aware. Now, before we proceed, have you tried any other treatments or home remedies?
Yes, I've tried a few things. I applied an over-the-counter antibiotic cream called Neosporin on them, but it didn't seem to do much. I also tried using warm compresses to ease the pain, which helped a little, but they never went away completely. For a while, I used some tea tree oil after reading about it online, but I don't think it made much of a difference.
Thank you for sharing all of that, Mihira. Based on what you've described, it seems like you might be dealing with ingrown hairs, especially given the location and characteristics.
Oh, that makes sense. I do shave quite often, especially on my legs and underarms. Is that what caused it?
Yes, frequent shaving or even waxing can sometimes irritate the hair follicles, leading to the problem. In more severe cases, the area can become infected, which might explain why some of them have developed pus. I'd recommend a few treatment steps to help with this.
What kind of treatment would help?
First, I suggest stopping shaving for a while to allow the affected areas to heal. You can switch to hair removal creams or consider laser treatments later on if shaving continues to be an issue. For now, I'll prescribe a topical antibiotic cream, such as mupirocin, to treat any infection. If the inflammation is quite severe, we can also use a mild steroid cream.
That sounds good. Thank you so much, Dr. Green. I'll follow the plan and see how it goes.
You're welcome, Mihira. Take care.
Extract 2. Questions 13 to 24. You hear a dentist talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Good afternoon, Mihira. I see from the notes that Nurse Susanna mentioned you've been experiencing some gum discomfort. Can you tell me a bit more about what's been going on?
Yes, doctor. It started off as just a mild sensitivity, but recently it's become quite painful. For the past couple of weeks, I've had this persistent soreness in my gums, especially when I'm brushing my teeth or eating. I've also noticed some bleeding when I brush and even sometimes when I eat harder foods like apples.
I see. That sounds quite uncomfortable, Mihira. Have you noticed any other changes?
Yes, there's definite swelling, especially around upper front teeth. My gums look more red than usual and almost puffy, if that makes sense. I feel like it's also affecting my breath. It hasn't been great lately, even though I brush twice a day.
That's understandable. Have you tried anything to relieve the symptoms so far, Mihira?
Yes, I tried rinsing my mouth with salt water a few times, which helped a little, but not for long. I also bought an over-the-counter mouthwash. It's called Corsadil, but the bleeding hasn't really stopped. I also switched to a softer toothbrush thinking that might help.
You've taken some good steps there, Mihira. Based on what you've told me, it sounds like you may be dealing with gingivitis, which is an inflammation of the gums caused by plaque buildup.
Oh, I see. Is it serious?
They can be serious if it's left untreated, as it can progress to more severe forms of gum disease like periodontitis, which can affect the supporting structures of the teeth. However, in your case, since you've caught it relatively early, it's quite manageable. We'll start with a thorough examination to confirm the diagnosis and assess the severity.
What kind of examinations will you do?
I'll begin with a full oral examination, paying close attention to the gum line and checking for signs of plaque buildup and tartar. I'll also use a periodontal probe to measure the depth of the pockets around your teeth. These measurements help determine how advanced the gum inflammation is. If necessary, we may take some X-rays to rule out any underlying bone loss.
Alright, that makes sense.
Once we have the full picture, the treatment will depend on how severe it is. In most cases, we'll start with a professional dental cleaning, also called scaling and polishing, to remove plaque and tartar, which you can't effectively get rid of with regular brushing. This should help alleviate the inflammation.
Will it be painful?
You may experience some mild discomfort, but we'll make sure you're as comfortable as possible throughout the procedure. After that, we'll likely recommend some at-home treatments. These might include using an antiseptic mouthwash for killing bacteria, and we may also prescribe an anti-inflammatory gel if the swelling is more severe. In terms of recovery, I would suggest coming back for a follow-up in 2 weeks to check on your progress.
I'll make sure to follow the treatment plan.
Great. We'll get started with the examination today, Mihira.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen.
Now look at question 25. You hear a nurse manager called Mihira speak to his team. Now read the question.
Team, we all play a crucial role in creating a culture of respect, collaboration, and teamwork. Remember, our patients are vulnerable and rely on us for their care. It's essential that we provide a compassionate and empathetic atmosphere. So, I want to emphasize the importance of maintaining a positive and supportive work environment. I also want to remind everyone of the importance of adhering to our policies and procedures. This includes following infection control guidelines, maintaining patient confidentiality, and complying with regulatory requirements. By following these guidelines, we can ensure the safety and well-being of our patients and colleagues. Lastly, let's prioritize continuous learning and development. We should always be striving to improve our skills and knowledge. Take advantage of opportunities for training and education to stay up to date with the latest advancements in healthcare.
Now look at question 26. You hear a doctor called Mihira discussing with a patient. Now read the question.
Mr. Kevin, I want to discuss some potential complications associated with the upcoming surgical procedure. While most surgeries are successful, there are always risks involved.
I understand, Dr. Mihira. I'm aware that there are potential complications with any surgery.
Some common complications include bleeding, infection, and adverse reactions to anesthesia. In rare cases, more serious complications can occur.
What are the chances of experiencing a serious complication?
The risk of serious complications is relatively low. However, it's important to be aware of the potential risks and discuss any concerns you may have.
Are there any specific factors that could increase the risk of complications?
Several factors can influence the risk of complications, such as your overall health, medical history, and the complexity of the procedure. We'll carefully assess your risk factors and take appropriate precautions.
I'm concerned about the recovery process. How long will it take to recover from the surgery, Dr. Mihira?
Recovery time varies depending on the type of surgery and your individual health. We'll provide you with specific instructions and monitor your progress closely.
Now look at question 27. You hear the head of a unit called Mihira talking to the duty doctor. Now read the question.
Dr. Harry, I'm concerned about Mr. Kevin's condition. His blood pressure is dropping, and he seems to be becoming increasingly lethargic.
Yes, Mihira, I've noticed those changes as well. His oxygen saturation is also low.
We need to act quickly. Let's prepare to administer intravenous fluids and monitor his vital signs closely. We might need to intubate him if his respiratory status deteriorates.
I'll prepare the necessary equipment and notify the respiratory therapist.
We should also consider the possibility of a pulmonary embolism. Order a CT scan of the chest to rule out that diagnosis.
Mihira, I'll coordinate the CT scan and inform Mr. Kevin's family about his condition.
It's important to communicate with the family and keep them updated on his progress. We'll need to provide them with information about his condition and the potential treatment options.
Now look at question 28. You hear a nurse called Mihira educating junior nurses. Now read the question.
Team, I want to emphasize the importance of effective communication and collaboration among all staff members. In the healthcare setting, clear and concise communication is essential for ensuring patient safety and providing high-quality care.
I agree with Mihira. Effective communication can help prevent misunderstandings and errors.
That's exactly right. When communicating with patients, it's important to use clear and simple language that they can understand. Avoid medical jargon and jargon that might be confusing.
I sometimes struggle with communicating with patients who have language barriers.
In those cases, it's important to use visual aids and gestures to help convey information. You might also consider using a translator or interpreter if necessary.
What about communication with other healthcare professionals, Mihira?
Clear and concise communication is equally important when interacting with other team members. Use effective communication channels, such as team meetings and written reports, to ensure everyone is on the same page. Now look at question 29. You hear a surgeon called Mihira talking to a GP. Now read the question. Dr. Harry, I'm referring Mr. Kevin for a preoperative evaluation. He's scheduled for a laparoscopic cholecystectomy next week.
Thank you for the referral, Dr. Mihira. I'll review Mr. Kevin's medical history and ensure he's cleared for surgery.
He has a history of hypertension and diabetes. Please ensure his blood pressure and blood sugar are well controlled before the surgery.
I'll review his medications and make any necessary adjustments. Are there any specific tests or procedures he needs to undergo before the surgery?
Yes, we'll need to conduct a preoperative evaluation, including blood tests, a chest X-ray, and an electrocardiogram. We also need to assess his lung function and ensure he's in good overall health.
Dr. Mihira, I'll schedule the necessary tests and inform Mr. Kevin about the preoperative preparations.
It's important to ensure Mr. Kevin is well prepared for the surgery. We should discuss any concerns he may have and provide him with clear instructions. Now look at question 30. You hear a doctor called Mihira talking to a GP. Now read the question. Dr. Harry, I'm concerned about Mr. Kevin's recent blood test results. His liver enzymes are elevated, and his bilirubin levels are abnormal.
That's concerning, Dr. Mihira. Have you ruled out any underlying medical conditions?
Yes, we've conducted a thorough evaluation, including imaging studies and blood tests. There's no evidence of a liver infection or other acute condition.
Could it be related to his medications? Sometimes, certain medications can cause liver damage.
That's a possibility. We'll need to review his medication regimen and consider adjusting or discontinuing any potential culprits.
Dr. Mihira, we should also monitor Mr. Kevin closely for any signs of jaundice or other symptoms of liver dysfunction.
Absolutely. I'll inform Mr. Kevin about the abnormal lab results and discuss the next steps. We may need to consult with a hepatologist for further evaluation.
That is the end of Part B. Now look at Part C.
Part C. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36. You hear the conversation between a pediatrician, Dr. Mihira, and an interviewer. Dr. Mihira, pediatricians hold a crucial role in a child's development and health, but this profession also seems extremely challenging. How difficult is it to be a pediatrician, given the unique needs of children?
Well, difficulty is often a matter of perspective, but pediatric care comes with a unique set of demands. Unlike adult patients, children, especially infants, cannot express their discomfort in clear words. As a pediatrician, you're responsible for more than just diagnosing symptoms. You're also navigating a delicate ecosystem that includes not only the child but also their family dynamics. In many cases, parents come in distressed, sometimes interpreting a child's mild fever as something much more serious. That emotional layer adds another level of complexity. Furthermore, children themselves behave differently during clinical examinations. Some may become anxious or fearful, and as a pediatrician, you have to soothe them while simultaneously gathering crucial diagnostic information. The stakes are high because a small misstep could affect the child's long-term development. So, it's not just physically exhausting, but mentally taxing. The challenge lies in balancing all these aspects while ensuring that your diagnosis is as accurate as possible.
That's truly intricate. Since infants can't communicate verbally, how do you manage to pinpoint their problems? It seems like solving a puzzle without all the pieces.
It does feel like that at times, yes. Infants, by their very nature, are enigmatic. But their bodies and behavior are surprisingly communicative once you know what to look for. You have to train yourself to observe micro-expressions, listen to the timbre of their cries, and take note of subtle physical changes. For example, a baby with colic will cry differently from a baby with an ear infection. It's in the pitch, the rhythm, and even the facial tension. Besides, I rely heavily on developmental milestones. If a baby isn't rolling over by a certain age or has difficulty maintaining eye contact, these can be signs of underlying developmental issues. You also get a wealth of information from physical indicators like skin tone, temperature, and breathing patterns. This kind of diagnostic work is a mix of scientific knowledge and an almost intuitive understanding that comes with experience. But the trickiest part is distinguishing between the normal, often noisy expressions of infant discomfort and something that signals a more serious condition.
Your observational skills seem almost superhuman. What are the specific techniques that you use to assess a child's condition accurately?
I wouldn't call it superhuman, just well-honed over time. Pediatric diagnosis rests on a multi-layered approach. First, there's the clinical observation of the child, as I mentioned. Then, I engage with the parents in a detailed discussion, often more extensive than what would be typical with adult patients. A parent's description of symptoms can be invaluable, but you must also filter their emotional interpretations, especially if the family is panicking. I use diagnostic tools like thermometers and stethoscopes, of course, but you also rely on developmental screenings and, when necessary, blood work or imaging. You may even turn to behavioral assessments for children who seem delayed in cognitive or motor development. The tricky part is triangulating all this information, the physical examination, parental accounts, and any diagnostic tests. Each piece of data has to fit into a cohesive picture before you can determine the appropriate treatment.
It's fascinating how you weave all these aspects together. Speaking of learning, when you mentor a junior pediatrician, how do you train them to deal with such complexity?
Training a junior pediatrician is a delicate balancing act in itself. They have the textbook knowledge, but what they lack is the experience to interpret real-life cases correctly. I start by encouraging them to develop their observational skills. They shadow me during consultations, and I ask them to describe what they noticed in each case. We then discuss their thought processes. Are they relying too heavily on one piece of information, or are they considering the child's full history and behavior? Communication with parents is another critical skill. I train them to ask open-ended questions and to listen not just to what is said, but how it's said. They also need to practice controlling their own emotions, especially in high-pressure situations, because if the pediatrician panics, the parents and child will too. Clinical techniques and the application of diagnostic tools come in later, but the foundation is always this deep sense of observation and communication.
It sounds like a long process of learning. With families playing such a central role, how much weight do you give to their interpretation of their child's condition? Are they often accurate?
Parents are both your greatest asset and, at times, a complicating factor. On one hand, they know their child better than anyone else and can notice early signs that even a trained pediatrician might miss in a brief consultation. On the other hand, they can be overwhelmed by anxiety or lack the medical knowledge to interpret symptoms correctly. Their insights are essential, but you also have to be careful not to let their emotional state color your diagnosis. For example, a parent might think a child is seriously ill because they're lethargic when in reality, it's a mild viral infection that's running its course. I'd say that parents are correct about 60 to 70% of the time when describing symptoms, but it's the pediatrician's job to fill in the gaps and apply medical reasoning.
Lastly, with all these complexities, are there any technological advancements that are helping you in pediatric care?
Absolutely. Technology has made a significant impact on pediatric care in recent years. We now have sophisticated diagnostic tools that can give us more precise data. For example, pulse oximeters can monitor a child's oxygen levels non-invasively, which is crucial for diagnosing respiratory issues early. We also use mobile apps and telemedicine to monitor chronic conditions, like asthma or diabetes, from home. This allows us to track the child's health more closely without requiring frequent hospital visits, which is particularly helpful for parents who live far from specialized care. Furthermore, artificial intelligence is beginning to play a role in analyzing large datasets of symptoms and diagnostic outcomes. This technology can offer predictive insights into a child's developmental path or help in identifying rare diseases based on subtle patterns that a human might overlook. However, it's important to remember that technology complements, but doesn't replace, the art of pediatric care.
Now look at Extract 2. Questions 37 to 42. You hear a doctor, Henry Marcus, talking about his role in patient care at Mihira Multispeciality Hospital. You now have 90 seconds to read questions 37 to 42.
Good morning, everyone. I am Dr. Henry Marcus, a biochemist by profession, and I'm delighted to share with you today how I, as a non-clinical doctor, contribute to patient care at Mihira Multispeciality Hospital. My journey here has provided me with a unique perspective, especially when viewed from the lens of biochemistry, where science often merges with patient outcomes in surprising ways. Although I do not directly interact with patients, my work is foundational to their well-being and recovery. As a biochemist, I am part of the Molecular Diagnostics and Biochemistry Department at Mihira. This department focuses on studying the biochemical processes within the human body, especially at the molecular level. Here, we analyze various biological specimens, blood, tissues, and other fluids, to unravel the molecular mechanisms that contribute to diseases. But our work extends far beyond the traditional role of diagnostics. We assist in understanding how different diseases progress at the molecular level, providing insights that often guide more precise treatments. Our department's work is twofold: diagnostic analysis and biochemical research. On the diagnostic side, we assist in analyzing complex biochemical data to detect metabolic disorders, enzyme deficiencies, and even genetic conditions that clinicians might otherwise miss. On the research side, we explore emerging trends in personalized medicine, where treatments can be customized based on a patient's unique biochemical profile. This allows us to give clinicians highly specific data that enable targeted treatment plans, elevating the standard of patient care. At Mihira, my responsibilities are not limited to running biochemical tests. I also have a pivotal role in contributing to clinical decision-making. My job involves translating intricate biochemical data into actionable insights for doctors and specialists. In this sense, I act as a bridge between science and practice, ensuring that clinical teams understand the molecular aspects of a patient's condition. For instance, when dealing with chronic diseases like diabetes or cardiovascular issues, my analysis helps determine the biochemical imbalances that underlie these conditions, aiding doctors in fine-tuning their treatment strategies. Another essential aspect of my role is to ensure that quality control and accuracy remain at the highest standards in all biochemical assessments conducted within the hospital. Given that medical decisions are often based on these results, maintaining precision is crucial. Furthermore, I lead biochemical research projects, contributing to cutting-edge discoveries that can ultimately translate into better patient care. Through collaborative research with other departments, we've managed to identify key biomarkers that aid in early disease detection and preventive medicine. The reports generated by my team and me are essential to the diagnostic and therapeutic pathways chosen for each patient. Often, these reports play a pivotal role in determining not only a diagnosis but also in defining the course of treatment. For instance, my analysis can uncover a rare enzyme deficiency that might mimic a more common illness, changing the treatment protocol entirely. Similarly, our research into biochemical markers is now increasingly used to predict disease susceptibility, allowing clinicians to recommend preemptive interventions before a patient even shows symptoms. Biochemistry data, particularly in molecular diagnostics, often reveals subtleties that could be overlooked in traditional clinical assessments. This makes our work indispensable in cases where diagnoses are unclear or treatment responses are unpredictable. When time-sensitive decisions must be made, my reports frequently provide the missing puzzle piece that ensures the right therapeutic interventions. A key aspect of my work is collaborating with a diverse range of professionals at Mihira Multispecialty Hospital. Effective patient care today relies on multidisciplinary teamwork, and biochemists are increasingly becoming integral members of these teams. I work closely with physicians, surgeons, oncologists, and even nutritionists to provide comprehensive patient care. A case in point would be working with the oncology department, where understanding the molecular basis of a tumor can significantly influence treatment choices. My analysis of tumor markers, genetic predispositions, and enzyme levels plays a vital role in crafting the personalized treatment plans that modern medicine champions. Additionally, I collaborate with the pharmacology team to evaluate how a patient's biochemical profile might affect their response to medication. Such collaboration is essential in developing pharmacogenomics, an emerging field that focuses on optimizing drug therapies based on a patient's genetic and biochemical makeup. Given that my work largely remains in the background, the recognition I receive is more internal than external. The hospital's administration and my colleagues often appreciate the precision and timeliness of our biochemical reports, especially when they have led to breakthroughs in difficult cases. For example, there was a case where our biochemical analysis revealed an uncommon metabolic disorder in a young patient, allowing for early treatment and a full recovery. Such moments of recognition validate the rigorous attention to detail we maintain in our work. However, as a biochemist, personal satisfaction often comes from seeing the results of our work reflected in patient outcomes. Although my face may not be at the bedside, my work is there, in every lab result and every revised treatment plan. For those aspiring to enter this field, particularly those leaning towards biochemistry and diagnostics, my recommendation is to develop a deep curiosity for molecular processes. Today, the integration of biochemistry with clinical practices is stronger than ever, so a firm grounding in both research and practical application is crucial. Upcoming doctors should also strive to be excellent communicators, as the ability to translate complex biochemical data into understandable, actionable information is a skill that's in high demand. Moreover, I encourage future doctors to embrace the role of technology in data analytics in modern medicine. As more hospitals adopt advanced diagnostic tools, the ability to interpret and apply this data will define the leaders of the future. Balancing research with clinical relevance is the key to success, and above all, maintaining a patient-centered approach even when working behind the scenes can make all the difference.
That is the end of your OET listening test. Now check the answers.